Board to order. It's on January 10th, 2019 meeting. And with that, could I have roll call, please?
Arbogast. Here. Weller. Here. Ambrose.
Here.
Carly.
Present.
Lovell.
Here.
Fittstem.
Here.
Mays.
Yes, I'm here on the end.
Herring.
Here.
Runyon.
Here.
Blackard.
Here.
Wilkie. Here. Killian.
Here.
Bunning.
Present.
Slagle.
Here.
Vietti.
Here.
Dyson.
Here.
Schaefer.
Yes.
Ingalls. Kestner.
Here.
Ritter.
Present.
Gerwin. Young.
Here.
Allen. Here.
Okay, on the agenda, the one thing I would like to move, we've got quite a few from the public here, and so I'd like to move those up ahead so they can talk. As soon as we get into the action agenda item, we'll let them talk. So with that, I'd ask for a motion to approve the agenda.
I'll move as amended.
I'll make a second.
Bunning and Ritter, all those in favor, signify by saying aye. Those opposed, same sign. If you would, yeah, I think it was my fault, I forgot and I was reminded. Could we all just stand up and say the pledge to the flag, please? Okay, the purpose tonight of being here is to decide on a resolution for a referendum question regarding the new tax rate and an increase in the limiting rate applicable under PTEL. And this is so we could continue home health care in the future. And with that, I know we have a lot of people, and so I would like to ask anyone outside of the board, if they please come forward, state your name and any comments that you have on this subject that you would like to have out before we begin deliberating.
I think it's illegal to. Yeah, we both grabbed one coming in.
You made me do it.
Hi, my name is Joan Lipinski. I think I've communicated with all but 4 of you, or at least received back and forth communication with all but 4 of you. We're asking that these 2 referenda not be put on the ballot because that would be very confusing to citizens, and it seems like another very rushed job, which was rushed because your original referenda in the November ballot was less than 10 days for you to determine doing it, and it turned out that there was a problem with that referendum. The citizens requested that the board find money in their budget to make sure that there was an adequate funding for basically what was the Livingston County Community Home Health Care Program, which dealt with both housekeeping services and health care services. The budget, the referendum that the board put on was for senior citizen health care services. We believe there's a need for people that want to stay in their homes, who are taxpayers, to have some additional services when they're low-income people. And 9,900 people agreed with that referendum. I know that some people felt there should have been additional taxes, but we seemed to feel that the board needed to at least investigate and find if there was room in their budget anywhere to find it. We've had lots of people tell us where there are areas in the budget where the money can be coming from, and we would really appreciate it if you wouldn't have new referenda on, if you would just spend a couple months discussing the possibility of finding money in your budget as you have set it, because you can't amend it, to do so. And if you have these discussions in public, people will be able to come in, and perhaps somebody else out there will be able to help you make some determinations that way, or find some areas where you can do that. If you go ahead and vote for them, we hope that you would have forums all over the county so that people can understand, because I know tax caps and P-TEL are very confusing to people. And we worked hard to have the people educated in what we wanted in our referendum and what the Livingston County Community Health Care Program did have in it. And they had a board that supported it, and it was sunset and people left, but people didn't leave just because they really wanted to, and there are still people in need for those type of services. So we just would like you to perhaps postpone this vote and have some public discussion to see if you can solve this problem. Thank you.
Thank you. Next up. Anyone else? Okay, Alina, would you just explain a little bit about the P-TEL situation and where we're at and why we're where we are?
Okay, so when the referenda was approved by the voters in November, we began to look at the process of looking what would need to be done in order to actually levy that tax. Obviously, there were some timing issues because of where we were with the 2019 budget, but we still were attempting to move forward and see what needed to be done. It was discovered at that time that there were additional referendum requirements that would need to be met under the P-TEL regulations. And then, but we still were looking at what that was. We were notified right before Christmas by the county clerk's office that the deadline for the board to approve placing something on the April election ballot is January 14th. So since that was prior to our next county board meeting, we went ahead and scheduled, and that's the only election in 2019. We decided to have the special meeting of the Finance Committee, and they approved that referendum request and called the special meeting tonight. So the referendums can be considered. Both questions must be approved by the voters in order for the Finance Committee to consider levying the tax for the fiscal year 2020 budget. Did that answer, Jasmine?
I think, thank you.
You're welcome.
Just a couple comments, and then I'll let the board discuss it. I understood that there was a citizens group that felt that there was money out here in other budgets, and I don't know where it is. I've talked to our bookkeeper, and when you make a budget, and we've already made it, and we've asked people, department heads and elected officials have been trimming their budget the last couple of years, and they're running a pretty tight ship. And when they were given what their budget was going to be, that was money that was going to be used for their department. And they have plans as to how they're going to spend that money. And if you would go and take $15,000 or $20,000 out of one budget, that could very severely crimp what they were going to do. Personally, and I shouldn't be at this point now, I guess, but I'll jump ahead and then I won't talk anymore. We started this extra help, senior citizens help, when we closed the nursing home. And we thought that would be a good program in case there were some people that were close and contemplating going into the county-owned nursing home. So we thought this would be a transition period for them. And of course, you know, I think it was. I think it's a good program. And if the citizens, which they did in Livingston County, voted that they wanted it, I'm all for doing what even though it was an advisory referendum, doing what they want us to do. And if they want home health care in this county, as a board member, I'm totally in favor of it. But we need help with the money, as all things do. And if we did have it go to a referendum here in April, and we need to do that so we can get the program, so Melinda knows and everybody that the program in December of 2019 could get up and get started running. The increase on a $100,000 assessed value house will be $7, around $7. And if we did it the full quarter of a cent rate, it would draw in 180,000. And I think Melinda has kind of thought we could do it maybe for 150,000. Yes? So we might not have to levy everything that we're even asking for. It's either we get, I'm only one vote, but it looks to me like if we do not vote on this and try to get it passed in April, then home health, if we get it passed, we can get the program up and running in December, this coming December. And if we do not get it passed, and which means the voters rejected it, and then we would have to still end it. We just don't have that kind of money laying around. At one time, we had more money. But costs go up to do business. Salaries go up. So with that, I'm going to turn it over to the board. Lena?
I just wanted to say one thing, just because I seen some eyebrows raising when you said the 750, so I want to explain the resolution a little bit more. One, it was a quick turnaround, and we did work hard to pull this together. It was probably about 3 weeks. We did hire outside counsel, legal counsel that actually had some PTEL experience, and we actually did review this with the Illinois Department of Revenue just to ensure that it was going to meet the requirements under PTEL. So even though we did move very, very quickly, we did so just so the board would have the opportunity to consider whether or not they wanted to move forward. In the resolution itself, it indicates that the increase value at the time that we're asking for the 2019 levy year, which is the payable 2020, and it would be for our 2020 budget, it says that that increase is $13.58. So there's, as with everything else under PTEL, there's a very complicated formula that goes into that. It takes into account the average increases in your levies over the last 4 years, I believe, and then takes that in addition to the .025, adds that into your levy, and that's how they come up with that increase there, as well as what the approved extendable amount will be at that time, just so everyone knows. So the 750 is what the maximum would be at the .025. The 1358 is what it would be with all the other levies included in with it, based on the average increase.
Total levy.
Total,
Yeah.
yep.
Okay, board members, questions, comments, thoughts?
Well, Mr. Chairman, to get the ball rolling, I'll motion that the resolution be placed on the ballot.
Okay, Mr. Schaefer, move the resolution be placed on the ballot. Is there a second?
Second it.
Who seconded it? Wilkie? Okay, now any discussion?
Mr. Chairman, I know I'm new down here.
Okay,
I know I'm new, but I also know that this board voted to sunset the program back in July 2017.
yeah.
How did we get to this point?
We had a citizens group that worked very hard, very industrious, and they gathered over 900 signatures, which was the requirement that they needed to get an issue like a referendum issue on the ballot. They got that number and more, and so it was placed on the ballot as an advisory referendum in November. So that's how we got here. And then we found out with PTEL and stuff that we had to go through another election, and that's what this is about. Are we going to have an election? Will the voters pass it? And economically, that $0.25 cent. They said they would as an advisory referendum back in November. I'm hoping they will do it, now and back it up.
Okay, because I also know that when I looked at the ballot in November, that the referendum to me was pretty confusing.
We've heard that. Any others? Mr. Bunning?
I hate to put you on the spot, Melinda, but could you please come forward here and tell us kind of where you're at, where you started 10 months ago, and where you're currently at? I think you spoke pretty well there last Thursday at the Finance Committee to let us know kind of exactly what kind of issues you've had to face.
Sure. Can you hear me? I'll give you a quick summary of the program. It was started in 2009. There are two components to the program. There is the home nursing program, and there is the home services program, which encompasses homemaking services, help with bathing. Both programs are licensed by the Illinois Department of Public Health. The home nursing, which I call basic public health nursing, is not being done by anybody else in the county. There is Medicare certified home health. That is usually for people with acute medical conditions. You go in the hospital, you come out, you have home health for short term, and usually after 3 stable visits, you get discharged. The public health nursing is more chronic disease management. It's for those people who need routine blood work but can't get out to the hospital to get it done. They need help with their medications to get them set up. We have been working with an out-of-state pharmacy who will mail medications in individual packets for breakfast, lunch, supper. But there are certain rules to qualify for it. Your prescriptions can't change regularly because it's more confusing to open the packets and try to figure out what pill you've got to substitute. You have to be on 5 medications. So for those people who change medication regularly because of blood thinning medication, it does not work. Anybody we could transfer over to the out-of-state pharmacy, we did. I checked today, and I think we have about 17, 18 people. With the home nursing program, I can integrate it with some of our other maternal child health programs. So when a nurse is out in the county seeing a baby, she sees a senior. So it's a little more cost effective because she can do both things. The homemaking program, we have always used CNAs, certified nurses' aides, because some family members do not want to help their family members with the bath. We go out, do an income assessment. We'll have a social worker do the income assessment to standardize it. And you have to score a certain amount to qualify for the program. So you can't just call me up and say, I want housekeeping. We go out, we assess, and we assess things like, can you fix your meals? Can you do laundry? Can you vacuum? And there's a score, and we require you to score at least 29. Half of that score is, do you have somebody else there available to help you? So if you have a family member, you're there to help you. We have changed, we use a sliding scale fee. It is tax supported with that. We look at the individual's income, not the couple's. The state program will do free homemaking services for anybody who is under 17,500 in assets, but your home's exempt, and 1 car is exempt, and some burial ground. But they don't look at any income. So you can have a large pension, but no assets, you qualify for the state. We kind of looked at income because it was easier to evaluate. I am looking at, for the nursing program, always having a social worker go out there and evaluate. We have worked with East Central Agency on Aging. They have a pilot program going to pay for medication management, which would be home nursing, but they have not rolled it out. They've had trouble with the software system. But that also rolls into the social worker because I do have social workers who go out, who have to do the choices for care, which is the nursing home pre-screens, and then they refer you to available resources. So I'm happy to answer any questions on the program. I will say I am trying to continue the home nursing because it is a little more economical for me and use the public health levy for that, but I cannot afford the home services without assistance.
Melinda, so you're figuring that amount, 150 to 180,000 would be what you needed for home services?
No, home
for
services,
both?
I'm figuring roughly about 100,000.
100,000 for that?
You know, and we have prioritized. With the program, you need to have full caseloads because, you know, it's more cost effective for me to send a CNA, say, up to Dwight for the day instead of you run up and back because then I've got to pay travel time and mileage. So you got to have full caseloads, otherwise the costs go way up.
And presently, are you still offering home services and home nursing?
No. Home services closed November 30th. Each year, there was a resolution that would tell me how much funding I could go up. The county paid me just what I paid, and it also included all the benefits such as IMRF and FICA. Instead of using those tax levies, they came out of whichever fund this was coming out of.
And how many, at the time they closed, how many clients were being serviced under home services roughly?
It varied by the year. You gave me 18 months to wind it down. I transferred 7 out, but we had plans in place, and they just wanted to keep their homemaker until as long as they could.
Okay.
So, yeah, we've had, I'd have to look back on the annual reports, which we're figuring, but we've had quite a few on it. I think in 2013 is when I had it at the probably peak capacity on both programs, and then it cost the county around $300,000.
Go ahead.
So earlier you mentioned that you've been able to accommodate the home nursing by working some things internally and working with that, and that home services were somewhere in the neighborhood of $100,000 to fund that program. And so if we're to look at the both programs as a whole, there's going to be, I would assume, an addition to the $100,000 to accommodate both of those. What kind of an addition are we looking at to fully take care of both of those? Is that the $150,000 that we see here, or is it more than that?
It kind of depends on what kind of criteria we put in. I've always said I could control the program by funding because I would tighten the criteria. If I can afford the home nursing under the public health levy, which I get, I want to say $385,000 under the public health levy, I'll take it under the public health levy and use the FICA and the IMRF levy to pay for the benefits side of it. So it all kind of depends on what you say for funding, what you're going to give me on the homemaking. If the whole goal was to keep people out of the nursing home off Medicaid, which it proved we basically did that for those clients that we delayed nursing home admittance and possibly saved money for the state.
Yeah, go ahead, Pat.
Yes, on this home services, since November, and that was basically shut down.
Yes.
Or it was shut down. How many people have come to you, applied, tried to apply? I mean, a guesstimate?
I really have no idea because I do have 3 social workers who do assessments, referral advocacy. They give them a list of others. So whether they can afford it or not. One of the things I will say with home services, we individualize the plan. So if you only needed an hour 3 times a week, so somebody would be in there to check, we would do that. We did not set minimums, whereas some agencies say you've got to take us 3-4 hours and pay us at a time. But yes, that does make the program a little more expensive.
So the last people, my last question or comment, I think for right now, the last people that were on it, and you said this is it, did they have something else lined up, or
Yes.
what happened to them?
We helped them line up. We started planning way in advance. We did not admit people to the program and said, okay, it is closing, or this is short term, and we helped them find other caregivers and transitioned them off because we weren't going to leave anybody in the lurch.
Thank you.
So what you're saying is everybody has transitioned into something?
Yes,
That-
some of them have hired the staff I laid off privately, in all honesty.
One other question, Melinda. If the board votes for this to go on the ballot and the people reject it, are you going to come in next year and request this type of program or more additional money to try to do what you believe in, or not? I mean, it seems to me if we say no, or if it goes on the ballot and the people say no, then the supporters here, they're going to have to go out there and work the public and explain all this stuff. But yet they want the program. They want these services to continue. What is their solution in your mind as the professional?
Okay, the solution is difficult. Yes, I could possibly come to the Finance Committee and say I'd like an increase in the public health levy to dedicate with that. What I use the public health levy for is to subsidize all the other programs. I also get fees whenever I can get fees, and then I can spend those in other programs. So it is a juggling act between the programs on what needs what. But yes, it would be very reasonable to expect me to come to the program and say, can I have an increase in my levy to support the program?
Anyone else? John?
Do you know the wording on the referendum question, specifically the Livingston County Home Health Care Program? Are you allowed to spend that on home services?
I don't know anything on the referendum as far as the legalities. I am licensed as a home services and a home nursing agency, not a home health.
I don't know, that wording seems a little, because you already are gonna fund as much of the home nursing as you can. And so the home services is sort of the part up for grabs. And if we're voting on a referendum on home health care program, maybe Alina would know, or, I don't know.
Sorry, I think I mentioned at the Finance Committee that the reason why that specific language was utilized is because that's what the board voted on when they put it on the ballot, on November's ballot, and so that's why it just carried over. What's required is that it be used for that program the way that it's written now. Does it have to be written like that? No, but it has to be the tax statute that you used before was specifically for senior citizens. So if you wanted to change it, you could change it, but I think the board was the one who wanted to limit what that could be used for. You can.
If we're doing what Melinda calls home nursing and home
Home
service.
nursing and home services, which home services encompass help with a bath, requiring a certified nurse's aide. Home nursing can use home health aides.
But you also mentioned that we're not licensed for home health care?
We are not a Medicare certified home health agency. We were at one time, but we gave that up, I want to say in 2003. The hospital operates home health.
So it's a fine line definition of home health care that we are
Okay,
not certified for home health care is the correct term?
Medicare certified home health care can bill Medicare and private insurance for the nursing visits. I cannot bill private insurance for my nursing visits as a home nursing. That's the difference. And it's a different set of regulations that I have to meet for licensure.
To be able to bill for the nursing visits.
Oh, I'd have to be a Medicare certified home health agency, and we could not compete against OSF and Advocate. It's acute care, you gotta do 24/7. No. It's a whole different licensure requirements. And why we got out of it is because fiscally it was not feasible for us to continue.
And approximately about 2/3 of the approximate 150,000, approximately 2/3 of that is for home services rather than home nursing.
Yes. With home services, we are required to have our certified nurses aid in the healthcare worker registry. We are required to do so much supervision, to go out in the homes, interview the clients, and do follow-up for it, provide continuing education. Whereas the RNs are more independent, they operate under physician's orders, so they can go in and do it and done. There's more of a layer of supervision with home services.
And a lot of these people that we were providing home services for, you say they transitioned into basically hiring your ex-employees or former employees or something?
No, just the ones at the end, at the 6. We had 6 left on in November that knew they were going to end. And they knew it was short-term because we did not put people on starting like early in the year for that.
How many do we have on now? 0?
On home services, 0, because I closed I shut it down completely so they knew. Home services, the most we have served was in fiscal year 2013, and we had 82 people on it. Out of those 82 people, we did 3,672 visits, and that translated into 5,293 hours of service, and 74% of those fell under the income level of, and I have to look what it was for, under 21,000. That fell under the income? 74. Okay, 74%. So at that time, with the volume, we were really targeting those with incomes under 21,000, but they didn't qualify for the state program, which was 17,500.
But the state program is based on assets, not income?
Right. And the state program evaluates it for one, so it depends on how you look at it. If you look at income, you're looking at income off the assets, kind of as your pension. What I like to say is, okay, so we tell you to sell your assets. Well, that's the same as telling you to sell your pension and see where you fall, take a lump sum for the pension. So depending on how you evaluate, what I have also found is for the age group we were serving, a lot of those women did not work outside the home, so they were just getting Social Security on their husband's record. So their income was lower. That would change in the current generation now. So, but the state only looked at the individuals. We had kind of talked about it and said, let's look at the couple's income. What we have not done is look at the household income. So if you bring in your parents to live with you, we don't look at the children's income to help them out. And that's more for the nursing part.
You do or you don't look
We
at
don't. We don't look at the children's income, but we're going to start looking at the couple's income as long as they're married. And that has changed, and every time I change the fees, it really confuses people, and for a while, it makes it harder.
Okay, anybody else for Melinda?
I got a question. I think I'm going to say this right. When Mr. Kistner said, if this don't go through, then you're going to come back and you're going to ask for changes in a budget to fund something there's no money for. Is that right?
No, I would come back and ask for an increase in my public health levy to help fund the public health nursing program. I'm trying to fund it now with what I currently have, and this is the test year.
But that money has to come from somewhere.
You would have to give me an increase in the levy. What traditionally happens is I've kept the same levy. It's like $384,000 on that, and I take whatever the finance committee tells me, and then I put in a capital improvement request or say, would you increase the levy for me? But that's, up to the finance committee when I put in the request.
Are you at your levy right now, your top of your levy, or where are you?
No, I can go up to 10 cents, and I want to say I'm only at half that, if that.
Okay, thank you.
And I would have to look that up in the budget, but no, I'm not, nowhere close.
What do you got? Okay, that's all I had.
Okay, just because I've heard it a couple times, I just want to respond so everybody is clear. So Melinda is not at her maximum under her, the rate that she's approved for. However, she is part of the county's aggregate. There's 14 levies that the county levies for. And so under the property tax extension limitation law, we still have limits, and Melinda's still part of that. So just to give you an idea of what those limits equate to, for 2019, what we will levy for this year's budget, we received across all 14 funds an increase of $288,000. For the prior year, we received an increase of $204,000. So of that, you would basically be saying 25%. If just the home nursing portion is requested, about 25% of the overall aggregate of every fund that we levy for would go to public health. And if it's anything more than that, you still would have to have a referendum to ask for the increase in the extension limitation.
Okay, Melinda, thank you. Board members, other comment? Christie, will you read the motion back to us? Huh? Okay, Tim, it was yours. Is that about right?
That would be so.
Okay, then we're going to go ahead and roll call vote this, Christie. A yes vote means you're putting it on the ballot. No vote means it does not go on the ballot, and the program is dead. So,
Are you ready?
Christie.
Arbogast. No. Weller.
No.
Ambrose. Carly.
No.
Lovell.
Yes.
Fitstum.
No.
Mays.
No.
Ehring.
Yes.
Runyon.
No.
Blackard.
No.
Wilkie.
Yes.
Killian.
Yes.
Bunning.
No.
Slagle.
Yes.
Vietti.
Yes.
Dyson.
No.
Schaefer.
Yes.
Kestner.
I would say yes.
Ritter.
No.
Young.
Yes.
Allen.
No.
Nine ayes and 12 nays.
Okay, motion was denied. The last thing, the announcement that I have, and I think probably all of you know this, but we need to do it at a public meeting, and that is we had a board member resign. Mr. Yoder resigned. I got the letter middle of last week, I think, and it was due to personal reasons, but he was proud to have served the board. And so, we will be trying to get a new board member from District 3. Has to reside in District 3, be a registered Republican. So if anybody knows anyone in District 3 that might be interested, you could please ask them, and if they are interested, get their phone number and give it to me, and I'll give them a call. So otherwise, I'm going to talk to, help me again with the name? Kirkton, Mr. Kirkton. And, but if you have anybody else, it doesn't have to be him. It can be anyone. So, okay. Any other announcements or anything?
There's the sign-in sheets for the planning sessions that are on your desk, so
Yep.
if you haven't gotten those to me, please turn those in.
Get 'em
before you leave
in.
Tonight, that'd be fantastic.
And we'll come back next week and have our regular board meeting. Thank you for coming tonight, and we'll see you next week. We need a motion to adjourn.
I'll make the motion.
Mays and who? Ritter? All those in favor, aye? Aye. Meeting adjourned.